Hi, it's Dr. Dasari. Typically on this channel, we discuss phytonutrition and its impact on health. Phytonutrients are compounds found in plants and fungi which have the ability to profoundly affect mind-gut immunity. I've had patients with long-standing chronic disease. I mean, you name it, fatigue, IBS, autoimmune disease like rheumatoid, multiple sclerosis, Crohn's, colitis, all get better with these dietary interventions. So that's what I spend a lot of my time focusing on in this channel. If this is something you're interested in knowing more about, please hit the subscribe button and turn on the notifications. Also, take a look in the description below. I'll put some introductory videos on this topic so you can take a more of a look. For today's discussion, we'll be focusing on umbilical hernias. We're going to be discussing about symptoms in both adults and babies. Number one, an outie belly button is really just a hernia. Umbilical hernias can happen in all age groups, starting from infants all the way up to people in their 90s or hundreds. Typically when they form in kids and in infants and babies, it's because the abdominal muscles, when they're in their mother's womb, fail to merge at the midline. Sometimes it can create a little space where hernias can form. Depending on how big this space is, it can create a large or small hernia in kids. If the hernia is causing problems, then typically you make a referral to a surgeon right away. However, the most common recommendation, at least for kids under 5, is to wait till at least 5 years of age and see if the abdominal muscles on either end just kind of come together and that hernia just goes away. Sometimes that innie belly button ends up becoming, or that outie belly button ends up becoming an innie, and it's no problem later on. When it happens in adults, it's usually due to massive amounts of weight gain or weight loss, or sometimes even during pregnancy. If you can imagine, the abdominal muscles stretch to accommodate that extra tissue, and that can create hernias. Number two, size can be totally misleading. I've seen it where small hernias, I'm talking few millimeters to centimeters, can cause massive problems, including bowel that gets stuck in there, bowel that can get incarcerated or even strangulated. That's when the blood supply to the bowel gets cut off and it perforates. And I've seen massive hernias, large size hernias that are quite large, cause zero problems at all. It's just kind of like, you know, people have like give them names and like kind of poke at it and they don't really worry about them. So I would caution you into thinking, oh, I've got a small hernia, it's not causing me any problems. It really has to do with the types of symptoms you're having, and you should really pay attention. Some of the risk factors for developing hernia: so if you're an infant, it's premature birth. If you're an adult, actually pregnancy is one of the most common causes of umbilical hernia in women. Also weight gain, weight loss. Again, I think I mentioned that earlier. If you can imagine a large amount of tissue stretching the abdominal cavity, some of those muscles can separate and cause hernias in places that you don't want them. The other very common reason to get hernias is actually just an increase in intra-abdominal pressure. And what that means is anytime you have to strain or push, you know, when you go, you know, that sense of like increasing your intrathoracic and intra-abdominal pressure to push on something. Maybe you're doing some heavy lifting, maybe you're just constipated, okay? Maybe it's an intense orgasm. I've seen that once. Ask me about that later. Smoking's another big one, and smoking, it's usually two causes. It's one, the smoke itself can weaken tissues, and so the tissue around the umbilicus can be a little weak. Also, some smokers have a cough, and a chronic cough can also increase intra-abdominal pressure, so that's something to look out for. Number three, exercises can help. Here's the thing. The deal with exercise, it can be a double-edged sword, right? If you're doing a lot of heavy lifting, straining, that can make a hernia worse. I prefer isometric exercises and aerobic exercises. Isometric exercises are very important because you can strengthen the core muscles without having a change in the muscle length, which is nice because you're not straining, and it forces you to do deep breathing. And the deep breathing is key. You have to breathe. If you take a deep breath in and out throughout the course of an exercise, you actually can't increase a whole lot your intra-abdominal pressure. You can't even push to strain like that. The straining can't happen if you're taking deep breaths. The second type of exercise is actually aerobic exercise. Things like jogging, things like elliptical, things like biking, and it's the same concept. You can't really jog and you can't really bike unless you're taking large deep breaths. Those large deep breaths prevent the intra-abdominal pressure from increasing. My strong advice is don't lift any heavy weight that causes you to strain. When you make that pushing sort of maneuver, it's really bad for you. Whether you're doing it in the gym, whether you're doing it in the toilet, whether you're doing it in the bedroom, it's all bad. Just don't strain like that. It really can make the hernia worse. Number 4, you can consider no mesh repair if you're thinking about surgery. So here's a little thing to think about. Hernia surgery has come a long ways. It used to be that we made really large incisions to try to repair these, and the recommendation from a lot of surgeons was that you need to use mesh, and mesh would be like a sort of like a plastic screen that you install underneath the hernia to kind of give it some reinforcement, if you will. A lot of surgeons will recommend that you place that mesh to decrease the chance that a hernia comes back again. Now, I'll post a link below because there have been dozens upon dozens of hernia mesh recalls by manufacturers, as well as, and this is from the FDA, so that list in the link below, that list I put together is actually straight from the FDA. But even on top of that, there have been successful lawsuits in this area. So my advice is talk to your surgeon and ask him what the options are. At least in my practice, I actually, if folks have a pretty open discussion with me, I'll kind of tell them what the recurrence risks are with and without mesh. And a lot of times, folks will opt for no mesh and have very, very good outcome. So I don't want you to think that there's only one way to do it. I will tell you this, that the most common recommendations are that you use a mesh and that the surgeon talks to you about the different options. Number 5, surgery. If you're thinking about it, you can do it with almost no pain at all. Most of my patients, they end up with maybe a 5mm incision, and that's about it. And that's to even fix hernias that are pretty big. Technology has come a long ways. It's not that we make these large cuts anymore to try to fix these hernias. We can actually do it with relative ease. It's same-day surgery. It may take only as little as 30-40 minutes, honestly. You're home the same day, and you're not even taking much narcotics or anything else. You're just taking a little bit of ibuprofen, maybe some Tylenol, and you get on with your day. I don't want you to delay getting a necessary operation thinking it's going to be some big dramatic thing. I would have a pretty honest discussion with your surgeon, make sure that they are trained in minimally invasive techniques and can give you the full gamut of options, including possibly repair without using a mesh. The surgical scar can actually be just as small as a few millimeters. Most of my patients end up with just a 5mm incision and they're done. Minimally invasive techniques, minimally invasive surgery has come a long ways, and those traditional very long operations with long scars, they've fallen out of favor, obviously. We've, I just discussed, the recovery time frame is a lot shorter, a lot faster than it used to be. And I would say even the surgical scarring is actually quite minimal. Some people get surgery and their family members can't even tell. Their friends can't even tell that they even had surgery. They can't even see the scar. And so, I think if you're afraid or you're nervous about what the surgery scar is going to look like, don't be, because I think, if you have a good surgeon, things should be okay. So I'd love to hear about your experiences dealing with hernias. If you want to leave some comments below, I love reading them, especially when, people have these crazy stories about, how they got their hernias. Also, if you found any of this information helpful in this video, please share it with someone you know who may also benefit from it. As always, be true to yourself. Surround yourself with people who affirm your well-being. Find a doctor who will slow down and listen. Find someone who carefully considers your concerns. And most of all, find one who cares.